Good afternoon, and thank you for allowing me to speak with you about a very important public health concern that affects over 2 million people yearly. My name is Michelle Garcia, and I am a DMP student at Gonzaga University. My goal as I progress through the program and graduate in 3 years is to specialize in infectious disease with a focus on antibiotic-resistant bacteria. According to the CDC, at least 2 million people yearly are infected with antibiotic-resistant bacteria, and another 23,000 people infected do not survive as a result. Let me give you a brief breakdown of antibiotic resistance and how it became a healthcare problem. Penicillin was the first antibiotic to be put into mass production after it was discovered by Alexander Fleming in 1928. The development and production of penicillin saved millions of lives. With this development of penicillin and other antibiotics, prescribing providers began to misuse this therapy, prescribing antibiotics inappropriately and incorrectly. Bacteria, being the survival masters they are, also developed survival techniques using mutation and gene therapy, which rendered current antibiotic therapy useless against infection. So the big question is, how do we address and fix this problem? I recommend implementing a policy to educate and standardize antibiotic prescribing techniques. This policy would use a ground-up method, starting with the involvement at a local level. The policy would use CDC guidelines to ensure appropriate antibiotic use. Education for healthcare providers, nurses, nurse practitioners, doctors, and pharmacists is imperative, as these healthcare providers will be the key advocates to promote the standard for appropriate antibiotic use. A policy will ensure prescribing providers are using appropriate antibiotic therapy, duration, and indication for use. Patients who demand antibiotics for any little sniffle or sneeze can be provided with education on resistant bacteria and the threat posed with inappropriate antibiotic use, with the CDC as the doctor's backup authority. The time for action is upon us, and implementing a policy for antibiotic stewardship is a key piece in the fight against antibiotic-resistant bacteria. Thank you for your time and consideration into implementing a policy to combat this health epidemic.